Good day everyone, I'm Christine Palaopsanan. Together with my groupmates, we'll be giving a presentation about strength training, its benefits and ailments. Let us first define what really resistance training is. Resistance training is also called strength training or weight training. It is the use of resistance to muscular contraction to build the strength, anaerobic endurance, and size of skeletal muscles. Resistance training is founded in the idea that when muscles are forced to overcome a resistance force, they will work to overcome it. Your muscles develop stronger when you practice resistance training on a regular basis. Strength training, aerobic activity, flexibility, and balancing exercises are all part of well-rounded fitness program. Strength training improves joint function, bone density, muscle, tendon, and ligament strength, while aerobic exercise improves heart and lung fitness. And that brings us to our next topic. Benefits of strength training. Research has shown that strength training can benefit your health and fitness in many different ways, and this will be explained by my groupmates.
To continue, this is Catherine Palingkuba, and now let us know the benefits of strength training. Strength training helps build lean muscle mass. Body lean mass is considered healthy if it is around 60 to 90% of your body weight. If a woman has a percentage of lean body mass under 68%, it is not healthy, and it is unhealthy for a man with less than 75% of lean body mass. Also, strength training reduces body fat and burn calories more efficiently if and after you've exercised. Strength training specifically leads to gain lean muscle. These are fat-free tissues that are highly metabolic, allowing more caloric burns than any other tissues in the body. Essentially, this is why strength training works best. It loses fat while maintaining muscles that burn calories. So, if weight loss is a goal of yours, incorporating strength training into your routine is key.
Strength training, along with sensible eating, can be instrumental in bringing about desired changes in overall body composition. Then it increases bone density and improves bone health. And strength training also boosts flexibility and improves range of motion.
Good day everyone, I am Arabel Era and our topic is about strength training benefits and ailments. My topic for this reporting is all about how to improve and reduce our benefit of strength training. Improve brain health and cognitive function. Also, it can improve your health and it can involve using one or more muscle groups to perform a specific task, such as lifting a weight or squatting, which is the symptoms of many chronic conditions, including back pain, diabetes, arthritis, and heart disease.
Another benefit of strength training is improved posture, balance, and stability. Maintain good posture and engage your core to get the full benefit and improve balance. Moreover, it raises energy levels. Exercise can increase your energy level. Getting outside in the fresh air may actually help more than enough for providing you with an energy boost and fighting off feelings of tiredness. Also improve mood and overall sense of well-being.
Good morning. I am Gilbert G. Chavez and I will be reporting on how regular exercise improve chronic conditions. So this is in line with the topic in strength training. So how can an exercise improve chronic condition? Well, one of the ways is through regular exercise. And why? So obviously, it reduces the pain and it helps maintain muscle strength in affected joints and reduce joint stiffness. It can also improve physical functions and quality of life for people who have arthritis and cancer. And it can also improve their fitness. So why regular exercise reduces the pain? Simply because it decreases inflammation as we keep on doing regular gentle exercise. It produces an anti-inflammatory response And this anti-inflammatory response occurs when tissues are injured by bacteria, heat, or any other causes, and the damaged cells release chemicals including histamine. And these chemicals cause the blood vessels to leak fluid into the tissues, causing the swelling. So regular exercise literally takes the inflammation and lowers the inflammatory response that is so often triggered in many chronic pain conditions. So what could happen if we do not exercise? Usually, we can experience pain in some parts of our body. And why? Because our muscles become inactive. So when our muscles are inactive, it weakens. So it becomes weak. So meaning, when we experience pain in our body, this is because there is a soreness in our muscles that literally results to the inflammation. So kung sa aton pa, may mga pamamaga, amo na nga sakit. Okay lang na kung hina ang sakit, pero since bata-bata pa man ta, we are at the low risk to experience this scenario. But as we grow, the likelihood is getting high since our muscles are becoming weak. Thus, we had the chance to experience this like joint pains, arthritis, and many others. So what do we do if this happens? Okay, so nothing we could do but to endure the pain, or we may take NSAID drugs to relieve it. But we can prevent this to happen if we take regular exercises as our habit. So that's it. Thank you.
Hello everyone, I am Jancy Esperon and I'm going to report about how aerobic exercise and strength training can help improve chronic diseases. So aerobic exercises can help improve your heart health and endurance and aid in weight loss. High intensity interval training is generally safe and effective for most people and can take less time. In high intensity interval training, you alternate exercising at high levels of intensity and exercising at a less intense level for short periods of time. Even activities such as walking and at higher intensities count.
Now, let us discuss how can flexibility exercise and stability exercise improve chronic condition. But first, let us know what flexibility, stability, and chronic condition are. So, flexibility is the ability of your muscle or your body part to relax and allow stretch and stretch forces, or the ability of your joints and body to execute their full range of motion. Stability, on the other hand, is defined as the ability to maintain control of joint movement or position by coordinating actions of surrounding tissues and the neuromuscular system. While chronic condition is disease or condition that usually lasts for 3 months or longer and may get worse over time. So the most common type of chronic diseases or conditions are cancer, heart disease, stroke, diabetes, and arthritis. So going back, how can flexibility exercise and stability exercise improve chronic condition? So flexibility and stability training exercises may help you to have optimal range of motion about your joints, help reduce the risk of injuries, help you to manage symptoms, improve strength, endurance, and posture, and can help maintain better blood sugar level, reduces aches and pains, improving the health of blood vessels, and improve health.
Our next topic is about the ailments that could be prevented or reversed with strength training. These are the heart disease, diabetes, asthma, back pain, arthritis, cancer, dementia, depression, obesity, and cardiovascular disease.
This all about heart disease is one of the ailments that could be prevented, reversed with strength training. Heart disease is regularly exercise can help improve your heart health. Recent studies have shown that interval training is often tolerated well in people with heart disease, and it can produce significant benefits. Some people say, what is heart disease, by the way? Heart disease is a range of conditions that affect your heart. That includes blood vessel disease, such as coronary artery disease. And also, some people say, how could the heart disease could be prevented or reversed with strength training? It can be prevented if we exercise regularly, because the heart can pump more blood through the body and continue working at optimal efficiency with little strain. Because strength training increasing lean muscle mass, it gives your cardiovascular system places to send to blood being pumped. And that's all my report. And we proceed to the next reporting. Thank you.
So again, good morning. This is Gilbert Chavez, and this is in the continuation with our topic about the strength training. And my topic is all about the diabetes, which is one of the ailments that can be prevented or reversed with strength training. So it is said that regular exercise can help insulin more effectively lower your blood sugar level. So physical activity can also help you control your weight and boost your energy. So what is diabetes all the way? So when we say diabetes, it is a chronic or long-lasting health condition that affects how your body turns food into energy. So meaning, if you are a diabetic person, most of the food you eat is broken down into sugar, also called glucose, and released into the bloodstream. So meaning, if you are a diabetic person, you have the high amount of blood sugar level in your body because you lack of insulin. So this insulin is a hormone that lowers the glucose, which is a type of sugar in the blood. So meaning, this diabetic person, kulang ni sila sa hormone nga insulin sa ilang lawas. That is why amon ang agataas ang ilang sugar level. So and this ailment, which is the diabetes, can be prevented by doing strength training. So the question is it okay to do strength training if you are a diabetic person? Well, obviously, the answer is yes. It is said that regular exercise can help insulin more effectively lower your blood sugar level. And according to the American Diabetes Association, they recommend that people with type 2 diabetes start a strength training program to help with blood sugar level control. So, why do we do strength training when you have a diabetes? Certainly because it responds to better insulin and it improves the way it uses blood sugar. And these are the things that we have to ponder in mind, that exercise is very important in our everyday lives. Because by doing so, we can overcome the pain. And it takes always ailments that may ruin our life. But we have to consider our strength or capacity in selecting the exercises that we have to perform. Much better if we take an advice from the experts or from the professionals before engaging to such activities to observe the proper way of doing the exercises. And this is very important. So far, dodra lang guro gaya na nga akong report. And these are all my report. We may now proceed to the next reporter if you have no more questions and clarifications. So, thank you.
Asthma. It is a long-term inflammatory disease of the airways of the lungs. It is characterized by variable and recurring symptoms, reversible airflow obstruction, and easily triggered bronchospasm. Symptoms include episodes of wheezing, coughing, chest tightness, and shortness of breath. This may occur a few times a day or a few times per week, depending on the person. Asthma symptoms may become worse at night or with exercise. People with asthma should still get proper exercises such as strength training, and with the right approach, it can benefit your asthma symptoms. These exercises helps by increasing your lung capacity, promoting blood flow to your lungs and heart, improving endurance, endurance and stamina, decreasing airway inflammation, and improving overall lung health.
Hello everyone, this is Jewelyn Gamboa. Another ailment that can be prevented or reversed by strength training is arthritis. So, when we say arthritis, it is the swelling and tenderness of one or more joints. It causes joint pains and stiffness, making it difficult for you to move and stay active. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. Some factors that causes arthritis are family history, age, injuries, obesity, and muscle weakness. So it is said that exercise can reduce pain, help maintain muscle strength in affected joints, and reduce joint stiffness. It can also improve physical function and quality of life for people who have arthritis. Strength training can also help you lose weight, which can greatly improve your symptoms if you have osteoarthritis in a weight-bearing joint like your hip, knee, or ankle. And the benefits of strength training aren't just true for those with osteoarthritis. Strength training has also been shown to help those with systemic inflammatory types of arthritis such as rheumatoid arthritis.
A pleasant day to all of us. I am Melboy Garson, and I will going to tackle another ailments that could be prevented or reversed with strength training. These are cancer and dementia. So what actually is cancer? It is a disease caused when cells divide uncontrollably and spread into surrounding tissues. This causes the affected part of the body to enlarge. So exercises can improve the quality of life for people who've had cancer, and it can also improve their fitness. According to studies, strength training or any kind of exercises aids in lowering the level of hormones such as estrogen and insulin. These hormones have been proven to correlate with cancer development. So to discuss further, insulin is the hormone that stores glucose from the food or foods we intake. These glucose are converted to energy during exercises. This means that having regular exercises can lower insulin level or lessen the stored fats or glucose from our body. Exercise can lower the risk of dying from any types of cancer, may it breast, colorectal, and prostate cancer. Second is dementia. The loss of cognitive functioning, thinking, remembering, and reasoning to such an extent that it interferes with a person's daily life and activities. Persons who suffers from this illness have difficulties on remembering things. So, strength training or exercise can improve cognition in people with dementia. It is because exercises improve the mind and prevent brain cells from dying or getting old. People who are active on a regular basis are at least risk of dementia and cognitive impairment. It is because engaging in a daily exercises will make your mind used to it. Exercises you do will be registered into your mind, thus your mind voluntarily recognizing it and remind you to do that the same time as you do it daily. That's all. Thank you.
Another ailments that could be prevented by strength training is depression. So what is depression? Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. It affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. Strength training can decrease depression and helps people deal with anger and develop confidence and assertiveness. How depression could be prevented by strength training. Strength training may help ease depression and anxiety by releasing feel-good endorphins, natural cannabis like brain chemicals or endogenous cannabinoids and other natural brain chemicals that can enhance your sense of well-being.
Good day everyone, this is John Mark Boris de la Cruz. This is my topic for the day is obesity. Obesity strength training along with sensible eating can be instrumental in bringing about desired changes in overall body composition. Obesity is a complex disease involving an excessive amount of body fat.
Other ailments that could be prevented or reversed with strength training is cardiovascular disease. Strength training can also help cardiovascular disease patients in other ways besides strengthening the heart. It can reduce the risk of disability and improve movement quality. So, cardiovascular disease is a type of disease that affects the heart or blood vessels. The risk of certain cardiovascular diseases may be increased by smoking, high blood pressure, high cholesterol, unhealthy diet, lack of exercise, and obesity. You can lower your risk of heart disease by doing strength training. Because strength training increases lean muscle mass, it gives your cardiovascular system places to send the blood being pumped. This results in less pressure on your arteries, which help reduce the chances of the heart-related problems.
Another ailments that could be prevented or reversed with strength training is the back pain. Back pain is the pain felt along the spine and it is a common ailment. The older you get, the more likely you are to experience it. In fact, the majority of people will cope with back pain at some point in their lives. But how does strength training could prevent back pain? Strengthening your back muscles is one way to help manage or even prevent non-specific back pain and improve range of motion. Regular low-impact aerobics activities can increase strength and endurance in your back and improve muscles function. Abdominal and back muscle exercises or core strengthening exercises may help reduce symptoms by strengthening the muscles around your spine. And that brings us to the end of our presentation about the strength training, its benefits and ailments. Thank you so much for watching.